Welcome to Anatomy DAHAR series. Today's topic is flow of the mouth and sublingual spaces. It includes oral cavity proper, vestibule of the mouth, flow of the mouth, and sublingual spaces. Illustrated, prepared and presented by Dr. Abdul Hamid, Abdul Rashid. The mouth. The mouth or oral cavity consists of two main parts, oral cavity proper and its outward extension, the vestibules of the mouth. Oral cavity proper. The oral cavity proper is the first chamber of the alimentary tract, that is the digestive tube. It is located in the head, below the nasal cavity, and between the upper and lower jaws. It has two openings, anterior and posterior openings, two lateral walls, one on each side, the roof above and the floor below. This is the sagittal sections of the oral cavity. Let's talk about the extents of the oral cavity proper. Anteriorly, back of the upper and lower incisor teeth, the gums, and anterior part of the alveolar processes. Laterally, upper and lower premolar and postmolar teeth, the gums, and lateral part of the alveolar processes. Posteriorly, oropharyngeal isthmus connected to the oropharynx behind. Superiorly, the roof formed by hard and soft palate, separating from the nasal cavity above. Inferiorly, the floor, mainly formed by mylohyoid muscles. Geniohyoid is above the mylohyoid, and anterior belly of digastric muscles are below the mylohyoid muscles. Vestibules of the mouth. Vestibules means space or cavity. Look at the diagram. This is the horizontal sections of the oral cavity proper. This is the teeth, and this is the lips, this is the cheek. Vestibule of the mouth is a narrow space. In this diagram, this blue color is the vestibule of the mouth, extended from anterior and lateral sides of the oral cavity proper. Vestibule of the mouth is located outside the teeth and the gums, and deep to the lips and the cheek. So between the teeth and between the cheek, this blue color area is the vestibule of the mouth. It is lined by reflection of mucous membrane from the lips and cheeks to the gums. Continuation of vestibules of the mouth. We have two diagrams here, diagram A and diagram B. This is oral cavity proper. This is oral cavity proper. This is the coronal sections of the oral cavity. This is the horizontal sections of the oral cavity proper. In diagram A, when the mouth is opened, oral cavity proper is directly communicated with the vestibule of the mouth on each side of the oral cavity proper. Here, on the right side and left side vestibules of the mouth, they are directly communicated with the oral cavity proper when the mouth is opened. But when the mouth is closed, the teeth are occluded, they are not directly communicated with the oral cavity proper. However, there is a little space behind the third molar tooth. The vestibule of the mouth on the lateral side is communicated behind the third molar tooth with the oral cavity proper. Flow of the mouth. Look at the diagram. This is posterior view of the mandible and hyoid bone. This is symphysis menti. Here is two pairs of mental spines, superior and inferior pairs. This is mylohyoid lines, and this is body of the hyoid bone. Flow of the mouth. It is a muscular diaphragm that is partitioned at the anterior horseshoe-shaped area of the oral cavity. It is situated beneath the anterior two-thirds of the tongue. The extents. Anteriorly, it extends from the posterior surface of the symphysis menti, just below the inferior pair of mental spines. Laterally, it is attached along the mylohyoid line of the mandible on each side, and posteriorly, it is attached to the body of the hyoid bone. Flow of the mouth is flat, cutter-shaped muscular layer, sloping downwards and backwards and attached to the body of the hyoid bones. It is covered by mucous membrane. Look at the diagrams here first. The first diagram is posterior view of the mandible and hyoid bone. Number 1, this is mylohyoid muscle, and number 2, this is geniohyoid muscle. This is inferior view of the mandible, and this is the hyoid bone, and we are showing anterior bellies of digastric muscles. So, muscular components of the flow of the mouth. It is a sling-like cutter-shaped muscular diaphragm formed by pairs of number 1, mylohyoid muscles, right and left. It is the main component. Number 2, geniohyoid muscles, which is attached anteriorly to the inferior mental spines and posteriorly to the body of the hyoid bone. And number 3, anterior bellies of digastric. It is inferior to the mylohyoid muscle and supporting mylohyoid from below. The flow of the mouth separates the oral cavity from the submandibular region and serves as a barrier from the spread of infection. This is the posterior view of the mandible and hyoid bone. This is mylohyoid line. Let's talk about number 1, mylohyoid muscles. Mylohyoid muscle has two parts, right and left. Each half of mylohyoid muscle originates from the whole length of the mylohyoid line on the inner surface of the mandible. The muscle fibers pass downwards and medially and form the cutter-shaped flow of the mouth. They insert into the median fibrous raphe, which extends from the posterior surface of the symphysis menti in front to the body of the hyoid bone behind. Each half of mylohyoid muscles is supplied by mylohyoid nerve, a branch of inferior alveolar nerve of the respective site. Raphe, Greek, means line of union of the halves of various symmetrical parts. This is posterior view of the mandible and hyoid bone. They are two pairs of mental spines, superior pair and inferior pair. Let's talk about geniohyoid muscle. They are a pair of slender muscles lie alongside the upper surface of the median raphe of the mylohyoid muscle. Geniohyoid muscles arise from the inferior mental spines anteriorly. They are at the back of the mandible and are inserted into the upper border of the body of the hyoid bones posteriorly. Each is supplied by the first cervical C1 nerve, which comes along the hypoglossal, that is 12th cranial nerve, of the respective side. This is the inferior view of the mandible and hyoid bone. This is digastric fossa, one on each side of the symphysis menti. This is intermediate tendons, one on each side. Let's talk about number 3, digastric muscles. A pair of digastric muscles, right and left side. Each side consists of two strap-like muscle bellies, anterior and posterior. They are connected by intermediate tendon. The anterior belly, these are the one, arose from the digastric fossa on each side, that is on the lower border of the mandible on either side of the symphysis menti. Anterior belly of digastric muscles diverge and pass posterior on the inferior surface of the mylohyoid muscles, and then through the intermediate tendon, anterior belly connects with the posterior belly of the digastric muscle, that is on each side. The anterior belly of the digastric muscle is supplied by mylohyoid branch of the inferior alveolar nerve. If we approach the floor of the mouth from outside, that is superficial or most inferior, you will see 3 layers of muscles which forms the floor of the mouth. The first layer, that is outermost or lowermost, is anterior bellies of 2 digastric muscles. You will see first. Above it, you will see the second layer's mylohyoid muscle. If you go to the second picture, diagram B, you can see again here is the mylohyoid muscles, and above it, that is deep to it, is a pair of geniohyoid muscles. So if you are coming as a surgeon from below, from outside, the first in submandibular region will be this muscle. This is anterior belly of digastric. Above you have mylohyoid, and above geniohyoid muscle. They are the muscular components of the floor of the mouth. Look at the diagram. The mouth is open and looking the under surface of the tongue. Okay, now we are going to talk about structures present on the floor of the mouth. This is the floor of the mouth. What are the structures? Number 1, frenulum of the tongue. That is a median mucosal fold attached between the under surface of the tongue and floor of the mouth. On each side are, number 2, sublingual papilla. This is the one, sublingual papilla. That is small nipple-shaped projection at the anterior part of the floor of the mouth. It has openings, ostiums there. Number 3 is submandibular duct. This is the submandibular duct. Coming from the submandibular salivary glands, it runs forward and opens at the ostium, that is the opening of the sublingual papilla. So make sure submandibular duct coming from the submandibular salivary glands will open at the sublingual papilla. These structures are covered by a thin layer of mucous membrane that is continuous with the mucous membrane lining the undersurface of the tongue. This is the mandible and hyoid bone. We are looking from behind. This is the coronal section. This is the tongue. And this is floor of the mouth formed by mylohyoid muscles. Let's see about sublingual spaces. What is sublingual spaces? Sub means under, lingua means tongue in Latin. That means sublingual spaces mean spaces or cavity located under the tongue. So locations of the sublingual spaces, one on each side, located between the ventral, that is under surface of the tongue, which is above, and floor of the mouth, which is below. So sublingual spaces are underneath, that is between the tongue, and below is the floor of the mouth. This is superior view of the mandible and hyoid bone, and this is oral cavity proper, and this is the tongue. We are going to talk about the sublingual spaces. In the diagram, sublingual spaces, these are the sublingual spaces. You can see here the lateral part is in blue color and the medial part is dotted lines here. This whole thing is sublingual spaces deep to the tongue. So, as the anterior part of the mandible is narrow and formed an arch, each sublingual space is bounded anteriorly by the inner surface of the symphysis menti and anterior half of the mandible above the mylohyoid line. So they are the bony borders of the sublingual spaces. Laterally on each side are hyoglossus muscles, but not shown in this diagram. Posteriorly, it is bounded by hyoid bone here. So these two are the sublingual spaces. Partly on the lateral side is in blue color, and on the medial side is the dotted line. They are below the tongue in the oral cavity proper. Structures separating the sublingual spaces. This is the coronal sections. These two are the sublingual spaces. This is hyoid bone and this is mandible. The first thing here, number one, is geniohyoid muscle. The muscle arises from the inferior pair of mental spine. Above them is genioglossus muscle. They come from the superior pair of mental spine and goes into the mouth. Okay, and above that one is a pair of inferior longitudinal intrinsic muscles. Now let's talk about the structures separating between two sublingual spaces, right and left spaces. The structures are, as I have mentioned earlier, a pair of geniohyoid muscles. They come from the inferior pair of mental spines. Above them is genioglossus muscle, the big muscle, fan-shaped muscle, which they come from each superior pair of mental spine. And finally, these two muscles, that is inferior longitudinal intrinsic muscles, are there. And posteriorly, there is the frenulum linguae. This is the mucosal fold coming from the lower surface of the tongue and attached to the floor of the mouth. They are forming medial relations of each sublingual space. This is the left lateral view of extrinsic muscles of the tongue. This is the tongue. This is palatoglossus muscle. This is styloglossus muscle. This is genioglossus muscle. And this is hyoglossus muscle. This is hyoid bone, body of the hyoid, and greater horn of the hyoid bone. Now we are going to explain about the hyoglossus muscle. It originates from the entire length of the greater horn and lateral part of the body of the hyoid bone. Hyoglossus muscle extends upwards as a quadrilateral sheet, the upper border interdigitating at right angles with the fibers of the styloglossus muscle. This hyoglossus muscle is inserted to the side of the tongue between styloglossus on lateral side and inferior longitudinal intrinsic muscles of the tongue on the medial side. Hyoglossus muscle depresses the side of the tongue and makes the dorsal surface convex. Hyoglossus muscle is supplied by hypoglossal, that is 12th cranial nerve. This is the diagram of left sublingual space seen from the left side. Let's talk about the contents of the sublingual space. Please see the diagram very carefully. The contents of the sublingual space include number 1, lingual nerve, number 2, submandibular ganglion suspended from the lingual nerve, number 3, sublingual salivary gland, number 4, submandibular duct and deep lobe of the submandibular salivary glands, number 5, lingual artery and branches together with lingual vein and tributaries, and number 6, hypoglossal, that is 12th cranial nerve together with accompanying vein. This is again left lateral view of the sublingual space. We are going to talk about the lingual nerve. This is hyoglossus muscles, lateral surface of the hyoglossus muscles. The lingual nerve. This is the lingual nerve. It comes down on the lateral surface of the hyoglossus muscle. It loops up and supplies the anterior 2/3 of the tongue for general sensory. The lingual nerve suspends the submandibular ganglion. Number 2. Lingual nerve gives 2 or more short ganglionic branches to the submandibular ganglion. The lingual nerve carries the cauda tympani nerve fibers which come through the facial, that is the 7th cranial nerve. Nerve supply of submandibular and sublingual salivary glands. Submandibular and sublingual salivary glands are supplied by parasympathetic, that is secretomotor, sympathetic vasomotor and general sensory nerve fibers. They pass through the submandibular ganglion. As both parasympathetic and sympathetic are motor fibers, they originate at the central part and pass through the peripheral part. In the submandibular ganglion, only preganglionic parasympathetic fibers synapsed and give postganglionic parasympathetic fibers. Sympathetic fibers just pass through the submandibular ganglion but do not synapse at the ganglion. General sensory fibers also pass through the submandibular ganglion. However, they begin at the peripheral part and pass towards the central part, reverse direction. General sensory fibers do not synapse at the ganglion. They reach to the trigeminal nucleus. Please see the next slide. Let's see the diagram. This is submandibular salivary gland. This is sublingual salivary glands. We are going to talk about the nerve supplies of these two salivary glands. They receive 3 types of nerve fibers. Parasympathetic, that is secretomotor, sympathetic, vasomotor, and general sensory nerve supply. Let's see the diagram. This is mandibular nerve, that is the third division of the trigeminal nerve. It gives lingual nerve. This is the brainstem. This is the pons. This is the facial nerve. It gives chorda tympani nerve, which joins the lingual nerve. Below the lingual nerve is submandibular ganglia, which is suspended from the lingual nerve by two or more short ganglionic branches. And we are going to say some more about the nerve fibers going through all this system. Now see here, parasympathetic and sympathetic. We have two types of arrows are there. One is continuous arrow, that is preganglionic, that is before the ganglia. Another one is dotted arrow, that is postganglionic, after the ganglia. So you will see two types of nerve fibers in each system, parasympathetic and sympathetic. Let's start with the parasympathetic system. Parasympathetic, that is secretomotor system, begins from the nucleus in the pons, that is superior salivatory nucleus. The nerve fibers comes out, look here, is a continuous arrow. That means preganglionic fibers, not synapse at the ganglion yet. It comes out along the facial nerve, chorda tympani nerve, lingual nerve, and enter into the submandibular ganglia. Only here these fibers will synapse. After synapse, dotted arrows are postganglionic parasympathetic fibers, supply the submandibular salivary glands and sublingual salivary glands for secretion. Next is sympathetic, very much similar to parasympathetic. They also have continuous preganglionic fibers and dotted postganglionic fibers. From where they come? T1, that is first thoracic segment of the spinal cord, the nucleus is there, comes out through the first thoracic spinal nerve. So it's a straight continuous line. So that is preganglionic fibers, sympathetic fibers. This is sympathetic chain. Along it, many sympathetic ganglions are there. This is superior cervical sympathetic ganglia. So this preganglionic sympathetic fibers coming from first thoracic segment through the first thoracic nerve will synapse here. Superior salivatory, superior cervical sympathetic ganglion, and become postganglionic fibers, dotted lines, come and forms a plexus around the facial artery, and postganglionic sympathetic fibers, dotted arrows, enter the submandibular ganglia and then supply the submandibular salivary glands. Some fibers, postganglionic fibers, sympathetic fibers will come along this one and supply the sublingual salivary glands. So for sympathetic, synapse is very early in the superior cervical sympathetic ganglia in the sympathetic chain. The rest are all postganglionic, that is dotted arrows supplying to these two salivary glands. The third is general sensory from two salivary glands, comes along the lingual nerve, then mandibular nerve, and finally reach to the trigeminal nucleus in the brainstem. Communications of the sublingual spaces, SLS. Internally, the right and the left sublingual spaces partially communicate through the median structures. Externally, They communicate with superiorly. Both sublingual and submandibular spaces communicate with the lateral pharyngeal spaces lateral to the pharynx. Posteriorly, the sublingual space communicates with the submandibular region around the posterior free margin of the mylohyoid muscle. Anteriorly, the sublingual space communicates with the submental triangle through the gap between the inferior margin of the symphysis mentae and the anterior border of the mylohyoid. Cellulitis of the floor of the mouth may spread above the mylohyoid to the submental region, leading to Ludwig angina. Infection may spread around the posterior border of the mylohyoid to the submandibular region or superiorly to the parapharyngeal regions. The end. Illustrated and presented by Dr. Abdul Hamid Abdul Rashid. Now is a good time to subscribe to our Anatomy DAHAR series channel. You will be notified as soon as our next video is available to you. Anatomy DAHAR series also provides other videos related to the present topic. Enjoy and thanks for watching.